Early epidemiological studies have consistently demonstrated a linear inverse association between HDL cholesterol levels and cardiovascular disease events. Several recent genetic and epidemiological studies have suggested that HDL cholesterol levels might not be predictive of cardiovascular outcomes in all populations, and have reported inverse associations with a plateau or even a U-shaped curve from sub-analyses, whereby very high levels of HDL cholesterol may be related to increased CV risk. In this issue of the JLA, Yang et al. Presented evidence supporting a protective link between HDL cholesterol and clinical CV risk. Studying 343,687 individuals from a large-scale nationwide cohort who underwent routine health examinations, the researchers reported that lower HDL cholesterol levels were closely related to a greater risk of mortality and CVD events including myocardial infarction and stroke, whereas extremely high HDL cholesterol levels were not associated with poor outcomes. They did not observe a U-shaped risk pattern between HDL cholesterol level and mortality, or CVD, events. In particular, regarding CV mortality and MI, the lowest risk was observed at the extreme high end of HDL cholesterol levels, which implies a strong inverse relationship between HDL cholesterol level and CV risk. According to the results, the higher the HDL cholesterol level, the better for lowering CV mortality and MI risk. HDL cholesterol levels alone might not adequately reflect the protective potential of HDL against atherogenesis, and that we should shift our focus to differentiating HDL subspecies and evaluating their function, instead of simply measuring circulating HDL cholesterol levels, to better understand the implications of HDL for CV risk assessment. Future studies will also need to explore which HDL cholesterol subclasses are suitable for therapeutic purposes. Some genetic mutations contributing to extremely high HDL cholesterol could simultaneously confer adverse CV risk. For instance, genetic variants with opposing effects on expression of endothelial lipase caused an elevation in plasma HDL cholesterol levels by reduced phospholipolysis, but did not demonstrate the expected decreased CV risk. Genetic mutations or therapies leading to elevation in HDL cholesterol have not consistently brought about the predicted decrease in CV risk, and some mutations have been associated with paradoxically increased risk. The association between HDL cholesterol levels and mortality might be mediated through complex interactions of several established CV risk factors. The interaction or coexistence of metabolic syndrome components with high HDL cholesterol levels could influence study results. Thus, differences in these components might lead to conflicting results. Circulating HDL cholesterol levels could be highly changeable over time, given the concept that metabolic health could be transient. In summary, future research on the evaluation of subclasses and functions of HDL cholesterol and clinical studies on the effects of changing HDL cholesterol levels would provide additional information on this issue. We should await further data linking HDL cholesterol to clinical endpoints.